Let's talk early morning wake-ups in babies. A wake-up time between 4 to 6 a.m. in the morning is considered early for infants and toddlers. Any time after 6 a.m. is fairly typical in children this age. Early morning wake-ups are exaggerated by the sleep pressure in our bodies being low in these early hours. Our bodies have had almost a full night's rest. The levels of melatonin, which is a hormone responsible for sleep, are low, and we are in the lighter stages of our sleep cycle. All of these make it difficult to fall back asleep when we wake up during these early hours. This is especially true for babies since they are yet to master the skill of connecting their sleep cycles. So what are some reasons that can cause early morning wake-ups in babies? The first is being overtired. While this doesn't sound intuitive, it's true. Being overtired is the most common cause for early morning wake-ups in babies. Overtiredness can be due to a late bedtime, not getting enough daytime sleep in the form of naps, and having a very early first nap such that babies think this is an extension of their nighttime sleep. Second, sleep conditions. Anything that can disturb sleep, such as light filtering into the room in the early hours or an increase in the ambient noise levels, can cause early morning wake-ups. And lastly, sleep regressions or teething. When your baby is trying to learn a new skill, their bodies and brains are focused on mastering that skill, and this results in a disruption of their sleep. Similarly, when your baby is unwell or teething, the discomfort can make it difficult for them to go back to sleep when they wake up during these early hours. So what are some things that can help with early wake-ups? Number one, an early bedtime. Parents often keep their babies up for longer in the hope that this will encourage them to sleep in the morning. Unfortunately, this has the opposite effect. In babies that are struggling with early morning wake-ups, advancing the bedtime and putting your babies to bed even 30 minutes earlier than usual can help them sleep for longer. Number two, focusing on age-appropriate wake intervals. Timing naps according to age-appropriate wake intervals will ensure that your baby's first nap is not too early and that they get enough daytime sleep so that they're not overtired at bedtime. And number three, creating ideal sleep conditions. Using blackout blinds to block out any light that might be entering the room during the early morning hours, using a sound machine or a fan to reduce the ambient noise and to mask any noises that might be disturbing your baby can be helpful.